This is an exam for skin check, and this patient will also have a biopsy.
So the first thing you want to do is create the exam. So you're going to go ahead and click on the arrow, go to normal exam, and we are doing a full body skin check without genitalia. So we're going to go ahead and click on that one. And now there's a couple things that we add for every skin check when we're doing a full body. So we always add the lentiginous and the nevi. So we're going to go ahead and go on the blue, create a new assessment and plan, and we will go ahead and type in lentiginous. Now she's doing a full body skin check, so we're going to click on any area of the body, and here you can go ahead and determine that it's going to be full body. Now we're going to go ahead and add a new one. I'll go under assessment and plan, go to nevi, and we're going to go ahead and click and make it go to full body. Now Dr. Kormeili determined that the patient needs a biopsy, so we're going to go ahead and add that in. You want to do this as soon as Dr. Kormeili recommends or starts talking about the biopsy. This is going to help you with the procedure in the room and your note as well. So we're going to go ahead and create a new one, and you're going to go ahead and go under assessment and plan. You're going to go ahead and type in BX, which is the abbreviation for biopsy, and we're going to go, you'll see all the biopsies that we can do. The ones we mainly do would be biopsy for a rule out of the basal cell, dysplastic nevus, squamous cell, or we also do the rash as well. Those are the most common ones, but they are not the only. Whenever you are not sure of which one you're going to do, you can double check with Dr. Kormeili by asking her in the room, Dr. Rule Out, and she will let you know. Let's say in this case, the rule out is for a dysplastic nevus, and it's right above her belly button. So you want to be as accurate as possible, and you want to have that added in before the doctor starts the procedure. You want to obviously consent your patient, and we want to make sure that we have a photo attached to the location. The way we do it is right when you finish setting it up, you'll see that there's a little camera that shows up right there. You want to take the picture from there. Click on the camera, and you will take a photo of your lesion, which is going to be the markings. Use. Done. And now you would go ahead and assist Dr. Kormeili with the biopsy in the room.
You can also use this to be able to determine the size of the biopsy,
which here we would go under the scalpel, click on here, and we can do the initial dimensions from here. So we'll do diameter. Let's say the initial site, it is 0.3. Perfect.
And now you could see in the body of the note all the stuff we put in is there, including this, which is neoplasm of uncertain behavior. Now what we need to do is generate a label for the bottle to have the same name and all the patient's information to be sent to the lab.
So what we do is we go back to the mannequin, and there's going to be a little printer icon right at the bottom. You're going to go up, and you're going to go ahead and click print. Again, we're printing a procedure, not a location. So we go to procedures, click on it, press done, and we print it to the brother.
That's the label maker, and it will show up on the desk.
There we go. You can see that there's the patient's name, date of birth, the exact location of the biopsy, and today's date.
Additionally, we need to have a requisition sheet to accompany this biopsy,
which would go to their progress note. We would go under forms, go to requisition, biopsy for today, click, print, and we want to switch to back to lab.
This is not a label, this is actually a piece of paper, and it will come out in the printer. Next, you have to log in the biopsy.